Hello, it's Dr. Savannah. I am here to demonstrate for you how to take the MARCoNS nasal swab sample. So I have here the testing kit. We've got the swab. You can see a very small Q-tip tip on this nasal swab, and then we have the collection tube. So I took the swab out. A couple things I want to say before I perform it and show you how to do it. We are not going up. We are going in and then leveling out and then going straight back. There's sort of a little groove that this tip will fall into. And as we go back, we will eventually meet the back of what's called the nasopharynx. The MARCoNS bacteria tends to live really deep in the nasal passages. So we want to get as far back as we can. Sometimes there's enough inflammation or biofilm or buildup of bacteria and other microbes that it's difficult to get the swab all the way back. This is why I use these are the pediatric swabs. They're a lot smaller than the adult swabs. And that's okay if you don't get all the way back. You have a second try on the other nostril. So go as far as you can. It might be a little uncomfortable. It might be really tickly. That's the experience I usually have. It shouldn't be painful. But likely it will make your eyes water and it will make you need to blow your nose. So have some tissues on hand. We'll do the first side and then take a breath and we'll do the second side. It's a very quick procedure. We just go in, we twist a couple times and we come back out. So I'll demonstrate to you how I do it on myself so that if your practitioner or if I'm your doctor, if your practitioner isn't around to perform the swab for you, you will understand how to safely and accurately do this for yourself. So what we do is we take the swab, we stick it in the nostril, and we go up a little bit, and then we level out. So it's straight, horizontal, and then I just start to slowly move it back to the back of the nasal passage. As you can see, I'm still talking here. It does tickle as I'm moving. Eyes starting to water. But once I get all the way back, I twist it around a couple times. And then slowly take it back out. And I might sneeze. It really starts to activate the salivation and the eyes watering and runny nose. So take a breath, pull your nose between if you need to. And then we do the second side. So same thing, stick it in the nostril. And we're not going up, we are leveling out and going straight back. So you go back. And once you feel the very back of the nasopharynx, you feel some resistance there. And then you take a couple swirls, and then I might sneeze again. Take it back out. Oh, that's hilarious. Okay, that's the procedure. And then you take the cap off of this tube, stick it in, and send it off with the collection materials with the this paper here all filled out. So with this, we want to make sure all of your information is here, your physician's name, and then typically for my patients, I'm checking these first two lines here. We're testing for MARCoNS, and then we're testing for the biofilm. So then you send it off, and the results will be faxed to your doctor within a week or a couple weeks. That is the MARCoNS nasal swab. Feel free to reach out to me if you have any questions. Hope that was helpful.